Hello. Today we'll be going over the procedures for assessing resting blood pressure. First, it is important that the patient refrains from smoking any cigarettes or ingesting caffeine for at least 30 minutes preceding the measurement. The patient should be seated quietly in a chair for at least 5 minutes with the back supported and feet flat on the floor uncrossed. We will be taking the measurement over a bare arm, and this arm should be elevated at heart level. It is important that we choose the appropriate cuff size to ensure accurate measurement. The bladder within the cuff should encircle at least 80% of the upper arm. We will now be aligning the cuff with the brachial artery. Again, it is important that we wrap firmly, but not too tightly. Now we will place the gauge on the cuff as both of our hands will be busy. Before assessing resting blood pressure, we need to make sure our ear prongs are facing forward and that our equipment is working. It's working. Now we are ready to assess resting blood pressure. First, we'll turn the valve all the way to the right and place the stethoscope on the brachial artery. We'll be pumping to 180 millimeters mercury to 220 millimeters mercury, or 20 millimeters mercury above the first quarter cough sound. We will release the valve at a rate of 2 millimeters to 5 millimeters mercury per second. We will now carefully be listening for the systolic blood pressure and diastolic blood pressure. Systolic blood pressure is the point at which the first or two or more quarter cough sounds is heard in phase 1. Diastolic blood pressure is the point before the disappearance of the quarter cough sound, phase 5. When we're finished assessing, it is important to note that before we could assess again, we must wait a minimum of 5 minutes before the next test.